Hi everyone, Eileen, veilleux the Film here. Welcome to the final installment in our mini-series on narcolepsy. In this series, we are going to cover the diagnosis, lifestyle and home treatment, and coping and support for narcolepsy. Before we begin the series, just a couple of reminders. Tomorrow, check on my community tab. Because there will be a poll for the next series that you want to cover. And also remember to watch the whole video and poll because there will be keywords in here at the end of the video with your comment. And please make sure it's a genuine comment. Add the 2 keywords in there to be entered into a merch giveaway for when I reach 2,000 subscribers. So, saying that, let's get started. The diagnosis for narcolepsy, though, how they do that is the doctor will take preliminary diagnosis based on your excessive daytime sleepiness and sudden loss of muscle tone. After initial diagnosis, your doctor may refer you to a sleep specialist for further evaluation. Formal diagnosis requires staying overnight at a sleep center for an in-depth sleep analysis by sleep specialists. Methods of diagnosing narcolepsy and determining its severity include sleep history. Your doctor will ask you for a detailed keyword sleep history. A part of the history involves filling out the Epworth Sleepiness Scale, which uses a series of short questions to gauge your degree of sleepiness. For instance, you indicate on a numbered scale how likely it is that you would doze off in certain situations, such as sitting down after lunch. Sleep records. You may be asked to keep a detailed diary of your sleep pattern for a week or two, so your doctor can compare how your sleep pattern and alertness are related. Often, in addition to the sleep log, the doctors will ask you to wear an actigraph. This device has the look and feel of a wristwatch. It measures periods of activity and rest and provides an indirect measure of how and when you sleep. Polysomnography is a test which measures a variety of signals during sleep using electrodes placed on your scalp. For this test, you must spend a night at a medical facility. The test measures the electrical activity of your brain and heart and the movement of your muscles and eyes. It also monitors your breathing. Also, multiple sleep latency test. This examination measures how long it takes you to fall asleep during the day. You'll be asked to take 4 or 5 naps, each nap 2 hours apart. Specialists will observe your sleep patterns. People who have narcolepsy fall asleep easily and enter in rapid eye movement sleep quickly. These tests can also help doctors rule out any other possible causes of your signs and symptoms. Other sleep disorders such as chronic sleep deprivation, the use of sedating medications, and sleep apnea can cause excessive daytime sleepiness. There is no cure for narcolepsy, but medications and lifestyle modifications can help you manage the symptoms. Some of the medications is keyword stimulants. Drugs that stimulate the central nervous system are the primary treatment to help people with narcolepsy stay awake during the day. Doctors often try Provigil or Nuvigil first for narcolepsy. Provigil and Nuvigil aren't as addictive as other stimulants and don't produce the highs and lows often associated with older stimulants. Side effects are uncommon, but may include headache, nausea, or anxiety. Some people need treatment with Abtensio XR, Concerta, Ritalin, and others, or various amphetamines. These medications are very effective but can be addictive. They may cause side effects such as nervousness or heart palpitations. Selective serotonin or SSRIs, or serotonin and neuroprene intake, or better known as SNRIs. Doctors often prescribe these medications which suppress REM sleep to help alleviate the symptoms of cataplexy, hypnagogic hallucinations, and sleep paralysis. They include Prozac, Serafim, Sulfurma, and Exafor XR. Side effects can include weight gain, insomnia, and digestive problems, though. Tricyclic antidepressants. These older depressants, such as Vicodil, Tofranil, and Anafil, are effective for cataplexy, but many people complain of side effects such as dry mouth and lightheadedness. Sodium oxybate, or Extreme. This medication is highly effective for cataplexy. Sodium oxybate helps to improve nighttime sleep, which is often poor in narcolepsy. In high doses, it may also help control daytime sleepiness. Excuse me. It must be taken in 2 doses, one at bedtime and one up to 4 hours later. Xyrem can have side effects such as nausea, bedwetting, and worsening of sleepwalking. Taking sodium oxybate together with other sleeping medications, narcotic pain relievers, or alcohol can lead to difficulty breathing, coma, and death. If you have other problems such as high blood pressure or diabetes, please ask your doctor about the medications you take to make sure that they don't interact with each other. Also, certain over-the-counter drugs such as allergy or cold medication can cause drowsiness. If you have narcolepsy, please tell your doctor and avoid taking their medications. Emergency treatments being investigated for narcolepsy includes drugs acting onto the histamine chemical system. The hypocetin gene therapy, and immune therapy. But further research is needed before any may be available for doctors.